Whoa, didn't see you there. My name's Josh, and I'm going to teach you how to deal with open and closed fractures. Let's see what's in my backpack. So what I brought to help demonstrate and show you how to deal with these fractures are a shirt, cloth, a cell phone, and rulers. And you're probably wondering what a closed or open fracture is, and why these things can help you. I'm going to tell you just how it is. So an open or closed fracture is when you break your bone. And that bone is very, it can either chip away, it'll break off into pieces, or a piece. Now, an open fracture is when the bone breaks off and is protruding outside of your skin. It has broken the skin, and there's probably some blood involved in that. A closed fracture is when the bone is still broken, but it is not sticking out of the skin, so you cannot see it. So going over the steps of what you should do if someone has an open or closed fracture is number one, you should ask them if they're okay. Do not try to move them, because then you could move the broken bone and it could cause more tearing of tissue, cartilage, or the skin. So what you do after they tell you they're not okay, you then see if their condition is life-threatening. That means if they're bleeding a lot, if they're becoming lightheaded, if they're dizzy. What you do is you call 911 on a cell phone, you get them there straight away. But if it is not life-threatening, you can create a splint. Now a splint is when you get two long pieces of sturdy material and you use them to guide and fasten the leg in place, or the bone. So you're probably wondering, how can a splint help? So when you break a bone, say my leg, if I broke my leg, I do not want to move it. Thus, these two splints, rulers, also shin guards work, long sticks, and anything that's very long and very strong. So what you do is you put the two splints on the outsides of the broken area. I'm going to say my leg, for example. You take a cloth, any cloth, it could be a t-shirt, it could be a rope, it could be duct tape, it could be any type of tape, and what you do is you furl it up so that it can become easier to tie with. So I'm going to do that right now. Now since I've furled it up, I'm going to put the two splints on each side of the affected area. I'm then going to tie the furled up, well, it's unfurling right now, but I'm going to tie the cloth around the two splints, like so. And you're going to tie it, double knot it, make sure it's fastened so it does not come off. You want to fasten it, you do not want to tie it so that your circulation goes out or that it squeezes your bone. You want the bone to stay in place, you want this to hold it, not to be painful and squeezing. Now what you do after you've done this is you help your friend who has a splint on. You use yourself as a crutch and you help guide him to the nearest car and vehicle and send him to the emergency room. And some common mistakes people make are that they do not think their fracture, they don't even know they have a fracture, or they just think it'll heal by itself. So what they do is they do not do a splint, they keep on doing the activity they're doing, which can cause the fractured bone to break off even more, to chip off even more, or to tear more tissue inside of you. So that is probably one of the main, I would say main problems people have with open and closed fractures. Thank you, and have a great rest of the day.